psychological assessment is the process of the psychologist evaluating a client through the means of tools, which can be standardized assessments, questionnaires, observations, psychological interviews, both structured and unstructured. And this assessment can consist of all of these methods or individual methods. The goal is for the psychologist to work towards taking the client's variables and seeing if it qualifies as a mental illness or diagnosis. Obviously, these tests aren't foolproof, but they establish a way to test validity and reliability. Many psychologists will begin with a psychological or a clinical interview to have a foundation or a basis to begin with. This can be structured with tools that ask direct questions and then follow a format based on the answers, or it can be unstructured and consist of open-ended questions such as, what emotions have you been feeling the last 2 weeks? Then there's the SKID test, and it provides structured questions and answers. This test provides all the dialogues, but does not provide flexibility. If the client freezes or is unable to answer, the Rorschach test or the Inkblot test allows the client to use their subconscious to tell what they are seeing on the page. The thematic cards show at least 2 people with various responses in their facial expressions and their body language. The client is asked to tell the story and give examples of the character or characters. A third example is objective tests such as MMPI that consist of over 500 questions, and the client answers based on the best fitting response. When assessing clients, some ethical issues may arise, such as deception. The psychologist may not inform the client what the means for the assessment is. The informed consent and the intake forms should be the first step in outlining the process for assessing the client. After the initial intake is done, the goal of the psychologist is to obtain the bigger picture for the client to see the severity of the issue and the possible goals for the treatment plan. To assess the client fully, the psychologist should go through the proper tools above by going through a clinical interview and considering the options for assessments and evaluations and asking some non-structured questions that put the client at ease and allowing them to also express what they have acknowledged and seen firsthand. Once the client has been through the proper assessments and evaluations, it would be wise to resort to the DSM-5 for any conflicting results or mobilities within the results. Once a diagnosis is reached, then the psychologist can evaluate whether the diagnosis could be harmful to the client. If they proceed with the diagnosis, they may refer the client out if they are unsure of the reliability or the validity. If they are sure of the diagnosis, they may begin treatment plan that is best suited for the client. Sometimes this can be to prevent harm or the client forming a bias because they understand the goal and work towards that goal subconsciously. Confidentiality can be another ethical issue if the individual's name is released or printed in any research and their results are given. And one last ethical issue is that the study, research, or assessment causes psychological harm to the client. This process could provoke feelings of anxiety, stress, fear, or unhappiness. The client must be aware of the option that they have consent to stop the research or assessment at any time if they feel uncomfortable or unable to continue. Thank you so much. Have a good week.